We're BIMA. We use mobile technology to bring insurance to underserved consumers in emerging markets. And these are the low-income customers that insurance companies have wanted to reach but thought it was impossible to reach. But as was just said, we have managed to reach millions of them. In fact, we've now got 30 million subscribers in 16 countries across Africa, Asia, and Latin America. Since we were here last year, our growth rates actually increased, and we're now onboarding around 575,000 new customers every single month. Today, we're going to talk to you about the technology that's fueled this phenomenal growth, and then how we're trying to replicate the disruptive impact that we've had on access in the area of service delivery, proving that even poorer consumers deserve to have a good customer experience and tangible value from their products. So I'm going to hand it over to Nicholas, who's going to take you through the first part of our demo.
Thank you, Nikki.
You're welcome.
So first of all, I'd like to take a moment to discuss a topic that I think that we haven't really covered with this event. And that's the fact the vast majority of the people on this world today are left uninsured. And how do big insurers tackle the challenge to reach out to these potential customers? The global protection gap leaves approximately 4 billion people uninsured, many of whom are low-income consumers living in emerging markets. These are the most vulnerable and exposed customers, and they face high levels of risk, crappy healthcare system, and exclusion from the formal financial system. Without a financial safety net in form of insurance, an incident of an accident, injury, or illness could easily tip these customers back into poverty. The initial response from the insurance industry was the creation of micro-insurance policies. Before BIMA came along, no other micro-insurance scheme managed to reach enough scale and profitability to make this work. And this is mainly because of two challenges: how to tackle these two barriers. The first one is how to access the customers. So how to create an accessible distribution channel. And secondly, how to collect the premiums. So how to create a recurring payment channel that works for the unbanked consumers. In BIMA, we early identified that mobile technology is uniquely positioned to resolve these two gaps. What we'll show today is our mobile platform that works as a digital channel for registration and payment. And this unlocks a great potential in the insurance market. This potential is approximately $40 billion worth that global insurers and insurance partners can take benefit of. So, in our BIMA model, we partner up with leading insurance companies like also leading mobile net operators like Axiata, Digicel, Tigo, and we integrate our technical platform with their existing billing technology. And this enables us to drive registration through and also bill payment premium collection. So if we could start the first demo, please. So after talking to a dedicated BIMA agent who provides vital education of how the insurance and the products are working, the customer experience is fully digital. As you can see on the screen, this customer is signing up using his mobile handset and the mobile phone number as the ID. And this process takes less than 90 seconds. This is of high benefit for our insurance partners. With this, we can now reach out to an entirely new mass market. And we can now reach out to some of the most remote communities on Earth. As an example, BIMA, we're now on track to bring insurance to more than 75,000 people in the most remote parts of the rural highlands of the Papua New Guinea. So, the second one is the payment. In order to get microinsurance right, and the biggest threat to the sustainability of the microinsurance is to get the payment mechanism working. Approximately 60% of BIMA customers lives on less than $2.50 per day, meaning that they can't afford it. It's impossible for yearly, quarterly, or even monthly fees. Also, more frequent premium collections through mobile agents or branch networks is highly costly for the insurer and also highly impractical for the customer. What we have done with our platform is that we have created a digital channel for these unbanked, a recurring digital channel for these unbanked consumers. Our platform our platform represents first time in the industry that we can allow our insurers to collect micro premiums. And this is a true game changer, and I will hand over to Nikki to talk more about this.
Thanks. Yeah, so by managing to solve the problem of how do you reach them and how do you efficiently collect payment from them, we've managed to bring insurance to millions of people, 90% of whom are trying it for the very first time. And whilst we're kind of continuing that journey with our enormous growth rate and really focusing on bringing insurance to people who've never had it before, we now want to replicate what we've done in the area of service delivery. And so when we're talking to these customers, they're now excited they have insurance, but they're just as demanding as the customers here. And when we spoke to them, we said, okay, if we're going to evolve our product offering, what is it that you want to see? And the answer from them was exactly the same as is from our insurance clients. And the obvious answer is health. For the customers, this gives them a real tangible benefit that they can see from insurance. And for our customers where money is tight, that's really important. And for us in the insurance company, it obviously gives us data on this consumer segment, which quite frankly, nobody knows anything about. But when we looked at launching the health product, and we started this sort of a year ago, we were facing the barrier of how do we keep the costs affordable? And we're talking about this is $1 for 3 months worth of cover. How do we keep it affordable and offer such a high level of service delivery that's involved in health? So our team's been working for the past year on devising both a product and a platform that can enable us to do this and still keep costs manageable. So at its core, it's a teledoctor service, which means that you can phone up and make an unlimited number of doctor consultations over the phone. And for our customers, this is a truly kind of paradigm shift in access. So you're going from, say, a customer in Bangladesh who typically can only afford to make one trip to a medical professional a year, that's usually in an emergency situation, to them being able to make as many calls as they want. So that's the core feature, and it's all powered by our platform. So I'm going to take you through the BIMA One platform now and how that enables us to deliver an international standard of care and gather information on our customers whilst keeping costs low. So every call that comes into our doctors uses this portal. It powers every consultation. And it allows us to deliver 3 things which give benefits for the user and for the insurance partner. So the first is that we're able to give continuity of care. So we're creating for these customers for the very first time medical history, a family medical history. For them, this has obvious benefits in that it's a more effective treatment plan. And for us, we're gathering this data that nobody's ever had before. The second is that we're able to give structured consultations. This is really efficient for us. It enables us to make us diagnoses within the World Health Organization's codes. Again, this is more effective. It prevents hospitalization events and even deaths, which obviously trigger claims events for us and our partners. And then finally, it enables us to connect with the wider health ecosystem that is starting to emerge in these markets. So we can connect with hospitals, pharmacies, and other players and really drive the evolution of the health and the insurance industry. So we started this, we launched it in Bangladesh as our first market. And in the past year alone, we've onboarded more than 1 million customers. So we see this as a huge opportunity to bring a second product to our base and to reach even more new customers. So we're really excited, and in the next year, we're going to roll this out probably across a lot more markets in the BIMA group. So what makes us different, I think, just to wrap up from the other customers that are here today, is that we're not a good idea, we're not a use case, we're actually a business that's thriving in 16 countries around the world. We're coupling our phenomenal scale with actual move towards sustainability. We're set to double the number of profitable countries we operate in the next year. And we're doing all of this while bringing services to people who really need it the most. Insurance can change lives for our customers, and we think more of you should be looking to get into emerging markets where there is a huge opportunity. And that's BIMA. Thanks.
Thank you.